back to my channel. It's your girl just Onyinyechi. If this is the first time coming across my YouTube channel, do not go anywhere. This is good for you. So guys, today we're going to be discussing dental calculus. Discuss calculus. I'm first going to tell you guys the series which they take is not much. So before a calculus is developed, first of all there's a pellicle. So pellicle is when like you eat, you brush, but regardless of the fact that you just brushed, after a little while, when you scrape your teeth, you're going to see something whitish. It might not be much, but very little. That's called a pellicle. After a pellicle, what you're going to get next is alba mater. Alba mater is that deposit in your mouth after eating. Those small food debris, that's what an alba mater is. And when you don't wash that out, it develops into a dental plaque. And when you leave a dental plaque and you don't brush it off, don't rinse it out, it develops into calculus. But calculus develops over time, because this is a calcified plaque. So it develops over time. So this is what we want to talk about today: dental calculus. That plaque that is calcified, that is now strong, that brush can no longer wash it off. You need to go through a medical treatment called scaling and polishing before this calculus can go off. So there's a picture here. I think I'm going to put it somewhere here. So this picture is what a dental calculus looks like. So you might be wondering, okay, some people, I had this people think that calculus is a normal thing, like it is part of your teeth. No, calculus is not part of your teeth. It's as a result of poor oral hygiene. You're not taking care of your mouth properly. That's the reason why calculus is coming and is staying. Perhaps people might have this calculus and they're not bothered about it because they feel like, okay, it's not painful, it's not doing anything to me. It's not painful maybe for the meantime, but trust me, calculus is like a protective shield to bacteria. They stick there, they keep sticking. These things develop, and then these bacteria feed on those things you eat, and then they release acid, and this acid demineralizes your tooth, which leads to cavity and decay, and that is what you do not want. Because as they graduate, when it leads to this cavity and decay, and this is when you start to feel pain, this is when you start to have halitosis. Even this cavity of a thing, this calculus on its own causes halitosis. When you speak, people perceive bad breath because all this is just food debris piling up, calcifying without you washing them off, doing something about it. So you tend to have halitosis. You're just bound to have mouth odor. So please, even if you don't feel pain, it's affecting your teeth. They might not start immediately, but with time it's going to tell on you. So if you have calculus on your mouth, this is the best time. Don't use knife, please. Some people, they use knife to scrape it out. It's very, very not advisable. You need to go to dental clinic for a removal. It's not difficult, there's no much thing, it's just called scaling and polishing. You just scale it out with the ultrasonic scaler and it goes off. It's more advisable and totally safe. So please, types of calculus, we have the subgingival and the supragingival. When it comes to sub and supra, it's just sub is under, supra is above. When you hear gingival, it means you're gone. So you might be wondering, how can you prevent dental calculus? It is easy. There's no much thing about it. You just have to brush twice a day. Brush right twice a day, in the morning and at night. Use toothpaste containing fluoride. Fluoride is very, very good for you. Containing fluoride, you always have to check, does this paste have fluoride? If it does, yes, then it is definitely very, very good for you. If it does not, please change and look for those that have fluoride. Floss daily. I know that most people don't floss, but that is what you should totally add as part of your daily routine. A day you should try as much as possible to floss at least once a day. Also rinse your mouth once in a while after eating something. Always just use water, gargle, throw it out. Watch your diet. Some diets can facilitate this kind of smoke. Do not smoke. Do not smoke. That's all I've got to say. So guys, this is pretty much the end of today's video. Thank you so much for watching through to the end. I love and appreciate you guys. I remain your girl, just Onyinyechi. Do not forget to like, subscribe, and continue supporting your girl. Do share my video, and I will see you guys in the next video. I love you all.